to the crowd. Okay, we are all set up. So welcome, welcome, welcome to our very first webinar on how to stop peeing your pants. I am so thrilled to have you all here. This is our first time doing this. If somebody could tell me, can you see the screen properly? Are you seeing half of my Zoom and half of the screen? Or are you seeing the webinar slides? Are we good? All right. Oh, you're amazing. Seeing slides and okay, perfect. Thank you. So this is our very first time running this webinar, and I'm actually very, very excited to bring this to you because what we're going to talk about today are a lot of the myths surrounding incontinence. I think that we have done a very good job of talking about it and a very good job of normalizing it. And what I would like to move this conversation towards is that, yes, we have nothing to be ashamed of, but also you don't have to live with it. Okay. So I want to run through a couple of things, and what's funny is in our clinic, we've got this nice plaque that says, "I laughed so hard, tears rolled down my legs." A client of mine bought it for me. We thought it was really funny. And it's funny, but it's actually not so funny because you do not have to leak when you laugh. So many clients of mine come to me and they say, I want to jump on the trampoline with my kids. I can do everything, but I can't jump on the trampoline because then I take my kids to Sky Zone and I need to bring a change of pants. Time for outfit number 2. How many times do you have a cold, sniffles, cough, and you need to wear pads, you need to rush to the bathroom, change your underwear when you're sneezing, rushing to the toilet, and just that self-talk, I'm going to make it. I think I can. And we're going to change to outfit number 3 today. Okay. Or how many of you walk into a store and know exactly where the bathroom signs are? If you could throw into the chat, which one of these is actually the most meaningful to you? My personal experience was I could not jump. I couldn't do the trampoline. And I knew I was the best bathroom locator in the GTA. I am located in Toronto, Canada, similar to you, Natalie. And I could, anywhere I go, I could have named exactly where every single bathroom was. I knew them like the back of my hand because I could not go anywhere. My family used to make so much fun of me. We couldn't do a car trip because if it was a 10-hour car trip, it was going to take us 15 hours because Hannah had to stop along the way all the time, every hour, in order to go to the bathroom. Number 3, laughter, all the above. Heavy deadlifts, yes. Heavy deadlift is also a thing. Heavy lifting, oh, so good. Okay, so again, what I want you to know is all of these things are not only treatable and you don't have to live with them, but it's also not as complicated as you think it's going to be. Okay, but enough about you. Let's talk about me. My name is Hannah Ross, and I am the pelvic health physiotherapist, and I am the clinic coordinator and owner of Vital Physiotherapy and Wellness in Midtown Toronto. And today I am so excited to share with you all about how to stop peeing your pants. Now, I'm going to stop my share for 1 minute. And I, just out of curiosity, I would love to know of all of the pieces of information that you have tried, what have you tried to do to address any of your leaking? You can throw that into the chat. How many of you have done Kegels? Yep. And have they worked? Christine, what does pelvic floor mean? Does pelvic floor mean pelvic floor, pelvic physio? What does that mean? Pelvic floor physio. And did it help? What did you do in pelvic floor physio? Did you do Kegels? Yes to both. Awesome. What else? What else have you all done? Botox in the bladder, and did Botox in the bladder help? To a certain point. Yeah, yeah. And it's so interesting that we, so much of what we know about the pelvic floor, so many of us just go straight to Kegels. And what I want you to know is, we're going to talk about this in a little bit, but most people are, number one, not doing Kegels correctly. And number two, it's usually not the solution. It's such a very narrow understanding of what has to happen in order to help you live a fulfilling life. It's not just about Kegling all the time. If it was, I would quite literally, my friends, not have a job. Okay. So let's go back to talking enough about you again. Let's go back to talking about me. I want to tell you a little bit about why I actually care about this. Okay. So I am a mother of 4. And like I said, I'm a pelvic floor physio, but I was not always a pelvic floor physio. I was a just regular old-fashioned physio before. I worked with backs and necks and hip pain and elbow pain and joint pain. And in between baby number 2, baby number 3, I was all in on doing P90X. I want to say this is not an affiliation or promotion of P90X, but for any of you who know what P90X was, it was a high intensity exercise program. It was a number of videos. They were DVDs back in the day. Okay. I'm aging myself, but work with me here. And you used to have to do heavy lifting, jumping. There was one particular video called plyometrics, and they had a specific movement. And that movement was a combination of what many of you said. It was called a rock star jump. Now, I'm not going to demonstrate it for you today because I'm not in workout clothing, but it was basically a combination of strumming a guitar and jumping up in the air and kicking your heels to your bum at the same time. And by rock star jump number 2, I had lost my bladder. Not only that, I was experiencing pain. I was experiencing so many symptoms. And when I went to my doctor, she sent me for an internal pelvic ultrasound, and she was like, everything looks good. You're good. And not only did I not feel good, I truly felt broken. I felt like there was something wrong with me. I didn't expect, I was never going to have kids again. I was like, I had 2 kids, and now for the rest of my life, I'm going to pee my pants. A friend of mine at that time, she was a coworker, a physio, was telling me about pelvic physiotherapy. And as she was telling me about it, because pelvic physiotherapy we're like the gynecologist of physiotherapists, okay? And as she's telling me about it, I was like, you do what? You are not coming anywhere close to me. And after, let's just say, many negotiations, she convinced me that she was going to be able to help me. And when I say to you that she changed my life, I am not exaggerating, because she not only helped me to stop leaking, she not only helped me to stop experiencing pain, but what she did was give me insight into my body so that I understood that not only was I not broken, I was absolutely perfect, and that my body has a strength that nobody had told me about. And now it is my mission to come and share that with you all today. I am so passionate about ensuring that you all know that you are not broken and what you're experiencing is absolutely fixable. Okay. Now, if you choose to do P90X after this webinar tonight, I'm going to ask you to please find me on Instagram. My handle is ChanaRossPT, ChanaRossPT, and please let me know that you've successfully done P90X. Okay. So let's dive into a little bit of anatomy. And then what we're going to do is we're going to go through the most common myths around incontinence, around leaking, things like that you've heard over and over and over again and are just not working. Okay. So let's talk about the pelvic floor. I'm a pelvic floor physio. I brought my handy pelvis with you. We're going to do a little anatomy, and it's really important because so many of us have no idea what is happening in our bodies and what our bodies are all about. Okay, so let's talk about what the pelvic floor is. Now, if everybody raises their hands, some of you have your video off. I can't see you, but I'm going to trust that you're using your hands. And you take your hands and you put it on your hip, where if you were angry and you put your hand there. Yes, that is the top of our pelvis right here. Okay, just for reference. And if you take your hands and you sit under your bum, you feel your sits bones. Under each bum cheek is a bone. Those are the bones right here and right here. Those are your sits bones. Okay. And if you take your finger and you put it at the very top of your bum crack, you're all sitting alone. Don't worry, except for Christine, might have her kids around, but place your hands at the top of your bum crack. That's actually touching your coccyx, your tailbone. Okay. And when we talk about our pelvic floor muscles, they are actually 3 layers of muscles that go from the front of the pelvis all the way to the back. This area right here, that pubic symphysis, that's where the mons pubis is, where the hair is on top of your vulva. The pelvic floor physios go from the front all the way side to each sits bone. They come all the way to the back to that coccyx that we just felt at the top of your bum crack. And they literally sit like 3 layers, 3 bowls at the bottom of your pelvis, holding up all of your organs, holding in your urine and your feces and your gas, helping you with healthy sexual function, helping to pump blood back to your heart, and helping to stabilize your core. Within a pelvic floor where there's a vagina, you've got your 3 orifices. You have your urethra, where your pee comes out of, your vagina, and your anus, where your poo comes out of. Okay, so the pelvic floor has 5 main functions. They support your all of your organs. They support your uterus, your bladder, and your rectum. I do get asked very often where I got my pelvic model from, and I now get it from a medical business, but you can find this on Amazon. If you walk away from this webinar loving the pelvic floor, you can get one of these on Amazon. Okay, so holds up all of your organs. Has a sphincter purpose. A sphincter muscle is a circular muscle, and its job is to contract and close and to relax and widen. And there are sphincter muscles around your urethra where your pee comes out of. This is your bladder. Your pelvic floor are a group of muscles, and they should clench and hold in your urine, and they should be able to relax and release your urine as well. Okay. These muscles are really important for healthy sexual function. They are really important to pump the blood back to your heart for healthy circulation, and they stabilize your core. Now, here's the thing. When we start to think about leaking, the very first place that we tend to go to, just like every other ache, pain, illness that we experience, is Dr. Google. But here's the thing, if you Google incontinence, number 1, you will be hit with a whole bunch of ads. Number 2, you're going to be sent conflicting information. It's very, very unclear. What should we do? What should we not do? Some of the information says, don't do anything. I have clients who are like, oh, Google told me to just keep exercising even though I'm leaking. Google said, never do any exercise if it causes leaking. I just stopped drinking water because I'm leaking. Like, there's so much information, and most of it is misinformation. So today we are going to do some myth busting. Okay. Now, we're calling this Vitals How to Stop Peeing Your Pants MythBusters. We've been setting the record straight since 2014 because Vital has existed since 2014, and we've made it our life's purpose to change people's lives from the inside out. We are changing the world one pelvic floor at a time. Okay, so let's start with MythBuster number 1. Now, here's how we play this game. I want to know, before we go on to the next slide, is this true or is this false? It is normal to leak as you age and or after you have kids. True or false? Throw that into the chat, please. Keep going. So we've got true, we've got true, we've got true, we've got true, we've got true. My friends, that is false. It is absolutely not normal to leak as your age or after having kids. It is very common, but that doesn't mean we should accept that as normal. Now, please don't hear me say that you are abnormal. That is not my intention at all. But what I want you to understand is that you do not have to take this as the expectation for the rest of your life that you will be leaking. That is not true. One of the #1 reasons for individuals to be admitted or to move into nursing homes, retirement homes, is because of incontinence, because families have a hard time managing their family members' incontinence. This is something that is treatable. This is something you do not have to live with, okay? Society tells us it's totally normal to leak postpartum. It's totally normal to leak as you age. We see lots of advertisements now of people, dancing around happy, lots of Depends commercials. And while I have to say, I do appreciate that we're actually having conversations around leaking, that we're not sitting in shame anymore. What I want to tell you is what I tell all of my clients, if you are experiencing leaking right now, please listen to this webinar, spend the time, understand what is going on. As long as you're doing your homework, you might need to wear a Depend here or there as you work to rehabilitate your system, your pelvic floor. Please don't go to Costco and buy these Depends. They should be a Band-Aid solution, okay? You can go and buy a small pack until you feel confident that your body and your bladder does not need it anymore, okay? Here's the impact. This is what we know. Not only does it decrease self-esteem, it impedes social activity. It impairs our emotional status. It leads to depression and isolation. We know that our clients, a lot of them will not leave the house because they're embarrassed. It impedes physical activity. If you're leaking when you're jumping and doing heavy lifting and exercising, people just choose to stop doing any form of physical activity. And there's a heavy economic burden. It really, really costs a lot of money to buy incontinence products. People are not going to work because they're incontinent. We do not have to live with this. So, as a reminder, one of the main jobs of the pelvic floor is that it's sphincteric. It maintains continence. If you are still leaking, that is just a sign that your pelvic floor needs a little TLC. It is not doing its job. It's a sign that we need to spend some time working on what the muscles do, okay? Again, there are these circular muscles here around your urethral sphincter, and it is their job to clench and hold in your urine. It is their job to relax and allow all of your urine out. We do have some clients, and they tell us that not only do they go to the washroom all the time and they know where every bathroom is, just like I did, but also they sit down on the toilet and they urinate and they always feel like there's something else there. They feel like they're not emptying properly. And that is another sign that those muscles are probably not relaxing well. Not only do these muscles have to be able to contract and hold things in, they actually also have to be able to relax and allow your urine out, allow a full stream of urine. Now, just like at the beginning of our conversation, when I asked you what resonates with you most, there are actually different kinds of incontinence. And this is where it gets fun for me, okay? So there are 3 main kinds of incontinence. Number 1 is stress incontinence. That's leaking when there's an increase in pressure, coughing, sneezing, jumping. That's a downward pressure on your pelvic floor muscles. Urge incontinence occurs when you have the urge to pee and you don't make it to the bathroom. That's when they're like, I think I can, I think I can, I think I can. Or something that we like to call key in the door syndrome, which is when you have a full bladder and just as you're arriving home, you're unlocking the car door and then you start to trickle. Some people lose their full bladder. Some people experience that as they're arriving to the bathroom or as they're taking their underwear off. Now, very special people experience mixed incontinence. And that's a little column A and a little column B. And that was me. And so I can tell you that you do not have to live with it. And I did not have to work that hard in order to recover from incontinence. So here's a number of different ways that you know that your sphincters aren't working the way that they should. So urinary incontinence, which is what we just talked about. Urinary urgency. So even if you're somebody who goes from 0 to 100, where you're walking around and all of a sudden you have a strong desire to pee, it goes from 0 to whoa, gotta go now. That's called urgency. And that is actually a sign that these muscles are not working as well. Urinary retention, what we were talking about before, when that sphincter muscle doesn't relax fully, so you can't fully evacuate the contents of your bladder. Bowel incontinence. Loss of gas. There's some people who they come in, they say, you know, it's really, really embarrassing. I'm farting when I don't want to, and they cannot hold it in. That is a sign that these sphincter muscles, you have sphincter muscles around your urethra where your pee comes out of, and you have sphincter muscles around your anus where your bowel movements come out of. If you cannot control that, if you lose gas, you lose your bowels. Or even if you're constipated, which is the bowels example of how urinary retention, well, constipation is the same thing. If we cannot relax that sphincter around your anus, you're not going to be able to properly release the contents of your bowel. And lastly, urinary frequency. These are my peeps who know exactly every single bathroom. They're the ones who have the small bladders, okay? Again, leaking is a sign that your body needs some TLC. It is not a sign that you are broken. I am going to be a broken record about this because we can and should expect more. Being told that this is just something we should expect as we age is not good enough. You deserve a body that functions well and that does all the things that you need to do in order to live a healthy, happy, functional life. Okay. Now, on to Mythbusters number 2. Throw it into the chat. True or false? I just need to do more Kegels to stop leaking. I think you've all experienced the reality of this, but please let me know, true or false? Do you still believe that if you just did more Kegels, this would go away? False. Okay, my friends, you have been listening. I'm very grateful. Yes, false. Dramatic false there. Okay. Here's the thing. Most women are not Kegeling correctly. So even if you are a body where Kegeling would be the appropriate exercise for you to do, most people are either using the incorrect muscles, or there are 3 areas of the pelvic floor. They're not using all of the areas of the pelvic floor. But not only that, the pelvic floor are muscles like any other. Just like your jaw, if you wanted to chew, you would not just clench your teeth all day long. That is not functional. In order to chew, you have to clench your jaw and release it, and clench your jaw and release it in order to chew food. Your pelvic floor is a group of muscles. You need to contract those muscles, i.e. Kegel, and relax them in order to be effective. Nobody has taught us how to relax our pelvic floor. Most of us are walking around all the time, Kegeling, 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 and we're not releasing or learning how to lengthen those muscles. But not only that, okay, most of our clients have muscles that are overworking. They are on all the time because we're just trying to get rid of this leaking and we're spending all day long Kegeling. But not only is it not, like this comes from the intention that we think that we need to Kegel because if we're leaking, our pelvic floor must be weak. But that's a very narrow perspective on what muscles do. In order for the pelvic floor to function, not only do we need to be strong, we also need to have endurance. So we need to be able to Kegel and release, and Kegel and release. Our muscles work all day long. They have to be flexible. They have to be able to go through both contraction and relaxation. When it comes to jumping, coughing, sneezing, if you have the strongest pelvic floor in the entire world and you cough, and then your pelvic floor turns on, you're actually not countering that downward pressure. So the timing of these muscles is really, really important. And last but not least, and this is my favorite part, the pelvic floor actually works together with your innermost abdominal muscles, your innermost back muscles, and your breathing diaphragm in order to stabilize and support your spine. The pelvic floor doesn't work alone. So Kegling alone is not effective. We need to work with this core system in order to retrain these muscles, okay? So what I want to do right now is I want to actually take you through the very first thing that we teach all of our clients, okay? And that is actually how to do a diaphragmatic breath. Now, again, can you hear me if I'm standing up? Can you hear me? Okay. The pelvic floor does not work alone. It works with our breathing diaphragm. Our breathing diaphragm is sort of upside down U-shaped, and it sits underneath your ribs. And when you take a breath in, it pushes down into your tummy. And when you exhale, it swings back up. So one of the most important things that we can do is actually start to learn how to diaphragmatically breathe. Because so many of us spend most of our time breathing in our upper chest. We're not even tapping into this very strong system that helps us with our continence. We're breathing up here. So many of us breathe into our upper chest. So what we're going to do is each of us is going to take our hands. We're going to find those sits bones. We're going to reach our hands under your bum cheeks. You're going to find those bony prominences. And you're going to make sure that you pull the tissue away from those sits bones and you actually sit on those sits bones. If you are sitting rounded like this, your pelvic floor is tucked under. It cannot work with your diaphragm. We need to sit in a way that our pelvic floor and our ribs are stacked over our pelvis, okay? Now, this is going to sound way easier than it actually is, because I'm actually going to ask you to slow down. You're going to want to do a deep breath. That is not what we are doing here. We are going to do a slow, gentle, diaphragmatic breath, okay? I'm going to give you a couple of different cues, different places to put your hands. And I just want you to pay attention to what's happening between those sits bones. Do you notice anything? Okay, so let's start off by just closing our eyes. And all I want you to do is just visualize your belly filling with air as you take a slow, gentle breath in. You breathe in through your nose, and you're going to gently exhale through your mouth, like you're blowing flower petals off of a flower. And we're going to visualize that belly filling with air, and you're going to gently exhale. The next thing that I want you to visualize is I want you to visualize a flower blooming. Dan and Martha, you're welcome. We're bringing oxygen into your brain. So you're going to visualize a flower blooming down and out of that urethra where your pee comes out of as you breathe in. Now, very important, this has to be a large flower. It can't be a little twig, because the pelvic floor, when it's contracted, when you're doing those Kegels, you're actually squeezing and lifting. So as you breathe in, I want you to visualize separating and blooming down. And then as you gently exhale, I want you to keep that flower bloomed. I'm going to give you one more cue. It's what I call awkward angry hands. Not that I ever get angry at my children. I love them very much. But if, again, putting your hands on your hips like you're angry, I want you to slide those arms up around your rib cage so that you're just underneath where a bra line would be if you're wearing a bra, okay? They're angry, but they're awkward. And you're just going to visualize, you're going to allow your ribs to move into your hands as you breathe in. And you visualize that flower blooming down and out, wide and full. And you're going to gently exhale and keep that flower bloom. Now, a flower bloom breath can be performed throughout the day. Very often, I'll have my clients perform it when they're on the toilet, often after they've gone to the bathroom, just because it's, for many people, it's the only time they're alone throughout the day. I suggest doing 5 to 10 at a time and really actually starting to spend time connecting with those muscles that are between your sits bones. Because so many of us we're just used to feeling things turn on. We don't know what it feels like to release there. The flower and bloom breath takes us from that kegel and lets us take that break and release that muscle so that your muscles are available and ready to turn on when they need it. Actually, so many of us get an absolute gold star when it comes to strength, when it comes to being really, really strong on our pelvic floors. But more often than not, it's actually the relaxation, I think, in life, but also in our pelvic floors that we need a little bit of work on. Okay. So let's move on to Mythbuster number 3. True or false? Drinking less water will help with leaking. I'm going to use that as a cue to throw it into the chat. True or false? Out of curiosity as well. False. Okay, you know my tricks now. This isn't fair. Out of curiosity, I want to know how many of you have actually started drinking less water, though? You know you should keep drinking water, but how many of you are actually drinking less water because you're nervous about leaking? Anybody? That was certainly me. I definitely chose not to drink water. I thought that it would help my frequent flyer miles in the bathroom. Yeah, when I go out, that's very, very common. But that was me also. Like, I just didn't want to, I didn't want to have to worry about it, right? Because it was actually on my mind all the time. So here's the thing. Water makes up 50 to 70% of our weight. It is absolutely a myth that if you don't drink water, you won't leak. It's actually the complete opposite, because dehydration actually concentrates the urine. It makes it more acidic, and it actually irritates the bladder, which creates more urgency, more leaking, and very often pelvic pain is associated with that. On top of that, dehydration is a major cause of constipation. And every time you're constipated, when you pass that stool, it's like a mini childbirth. And then we have to rehab the pelvic floor over and over and over again. So here are some actionable tips for you to take tonight and use. Try 6 to 8 cups of water a day and see how you feel. If you're like at 2 cups of water right now, don't try to go to 6, please. Add on 1 cup of water tomorrow and see how you do for a week, and then add another one on. If you go from 2 to 8, you probably will be spending all day long in the bathroom because your bladder's just not used to it. So it will take some time to train it. Remember to sip and not chug. You know the old saying, it's not what you say, it's how you say it. The same is true for how you drink. It's not necessarily what you drink, it's how you drink it. So you might be drinking 6 to 8 cups of water a day right now, but you might be just chugging that cup of water. What that actually does is it creates a stretch reflex in the bladder. It doesn't give your body enough time to actually use that those water molecules, and you end up just peeing out that water and you remain dehydrated. I will not tell you to get rid of your caffeine, but what I will say is drink water when you drink caffeine. And your thirst is enough. If you're acclimated to not drinking water regularly, your sensation of thirst may not be indicative of how much water you actually need to drink. So we can train our body to not want the water just because it's what we've gotten used to. So don't rely on your thirst, your feeling of thirst to begin with. but that will actually get trained as well as you start to slowly add in more water. Okay. So MythBusters number 4. I kind of gave this one away earlier, but let's play this game anyhow. I have a small bladder. That's why I have to pee all the time. True or false? How many, and also let me know, how many of you actually believe that you have a small bladder? Some false, some true, some false. How many of you actually think that you have a small bladder? That was certainly me. I mean, actually, even in my childhood, I believed that I had a small bladder. No, not small bladder for you? Yes. Yes for Lori, no for Lorinda. Okay. Clearly, this is false. Okay. Here's the thing. The pelvic floor works together with our nervous system, and there are behavioral things that we can train as well. So the bladder and the pelvic floor and the brain work together as a system. When the bladder reaches its fill line, it sends a message to the brain and says, I'm full, which then the brain will send a message to the pelvic floor muscles to relax. Issues arise when we start to send that signal way too early, when the bladder is only 1/10 full, or if we're really, really nervous and we're anticipating something, some of it, then our nervous system actually our nerves start sending signals to the bladder to go, to go, to go, to go, to go. They start sending signals to the pelvic floor to clench, to clench, to clench, to clench. We actually cannot train the muscular system, that pelvic floor, that core, that inner abs, inner back muscles, diaphragm, without acknowledging that the nervous system addresses it too, and that behaviors like just in casing, every time we're going to go out, we're starting to train. If you just in case, you're actually training the bladder. You don't feel the urge to pee, but your bladder is half full. You start to train that bladder to send the signal up to the brain. I'm full, that I need to pee when I'm half full, instead of sending that signal when it's 100% full. So leaking is not only about the pelvic floor. This is one of the major reasons why just Kegling isn't going to get rid of that leaking. We know that when back in the day, when we were running away from a tiger, it didn't make sense to just do it just in case, just quickly go run just in case. So when our brain thinks it's running away from a tiger, when we're stressed, when we're overwhelmed, when we're busy, when we're nervous, we actually get our brain sends a signal to our pelvic floor to clench. So if you have to pee and your bladder is full, the bladder and the pelvic floor, they're both muscles and they have equal and opposite jobs. The bladder fills when it's relaxed, and the pelvic floor should be on all the time, holding on that hose at the bottom of the bladder, that urethra, to make sure that we don't leak urine. But as soon as that bladder gets full, as soon as our friend here reaches its fill line, then the bladder starts to contract and the pelvic floor should relax. If you're standing in line at Costco, when you feel you have to pee, you actually need to be able to tell the bladder no by Kegling and turning the bladder and letting the bladder relax again. If you're walking around contracted all the time, you cannot contract anymore. If you're nervous all the time, if we're stressed, if our nervous system is in what we call an upregulated state, which most of us living in Toronto, living in the GTA, living through a pandemic, living a very, very busy life, we are all learning that balance between stress and relaxation in our nervous system. So we need to learn how to relax those muscles, not just because we have to learn to relax them so they can work, but because there's an entire system that is dependent on us creating that balance between stress and restoration, relaxation. And when I say relaxation, I don't mean vacation. I mean actually evoking the nervous system relaxation response. There's a sympathetic system, which is that go, 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 that fight or flight. And there's that parasympathetic system, that rest and relax. And we need to learn how to balance those things. Personally, I mean, I was a little bit of a, I'm a little bit of a type A personality. Let's just say that. And every time when I was in school, every time I would go, I was taking exams, I was running back and forth to the bathroom. I had a nervous stomach. When I'm in airports, hopefully we will all be traveling lots and lots more now that we can. It's very interesting when you're waiting for a flight to see how many people are going in and out of that bathroom. So many people pee so many times before they fly. That is not because their bladder just happens to be fuller before they fly. It's a nervous system response. So when we're talking about whether or not you have a small bladder, it's not the bladder. It's actually our whole system needs to be supported. So this is one of our amazing testimonials from one of our clients. She said, I'm a healthy, active 67-year-old woman who was referred to vital physiotherapy by a family doctor when I complained that I experienced urinary leakage when I sneezed. Pelvic floor therapy was all new to me, but I wanted to see if I could remedy this embarrassing condition. I'm happy to report that after 4 months of meeting regularly with my physiotherapist, Talia, I have achieved my goals. Talia always made you feel comfortable, supported, and encouraged, and was always quick to respond with questions, concerns that I had, and I'm very grateful. I no longer have to go inward, go into awkward contortions to prevent leakage when sneezing or coughing. Now, I want you to know that Linda was not alone, that we can help you find your strength from the inside out. What we do amazingly at Vital is helping people find their strength, take control of their own healing journeys, learn not to rely on us, but to actually rely on their own bodies and their own signals so that they can start to trust their bodies again. Now, I do want you to take those 4 myths and start to learn how to balance your nervous system, how to breathe, how to do your diaphragmatic breathing, start to drink your water, start to do those pieces to actually help you to stop leaking, stop peeing your pants. But one of the main things that I want to ask you is, if you are ready and you are ready to do this in a supported way, ready to take control finally of your pelvic floor, stop worrying about leaking, to stop leaking from taking over your life, and ready to actually go in and live your life. I want you to go out there and start jumping on those trampolines. Stop working out without worrying. Run again, cough, sneeze, laugh without those tears running down your legs. I want you to make it to the bathroom with time to spare. And I'm sure you have many beautiful outfits, but I just want you to wear one outfit a day, unless you choose to change it for fashion purposes, in which case, all the power to you. I want to tell you about a new program that we are launching. It is a beta, which means it is the very first time that we are running it. I'm really, really excited about this because it is a way for us to support more people and get the word out there that you do not have to live like this. Okay. Now this is called Vital's Leak Less Method, How to Stop Peeing Your Pants. It is a live online small group program. It involves 6 sessions, 45 minutes over an 8-week period. We are going to give you all of the information that you would regularly get in a one-on-one physio session, all the education, a lot of the movements, a lot of the self-help tips. We're going to guide you through a group where you're supported each week in order to get to your pelvic health goals and to stop leaking. Every single session is going to include learning, movement, and you're going to walk around out with practical steps. We are actually going to do every single time a bladder diary. That is what we do with our clients who are experiencing incontinence. You're actually going to track your outcomes. You're going to see things getting better objectively. We're going to do that every single session so that you can see, you'll do it in between sessions actually, so that we can get a handle on what is it that you need to focus on in order to improve your pelvic floor. Now, there's not going to be any internal pelvic physio here. You do not have to come in and travel. You don't have to, you don't have to set aside that time in order to be one-on-one with the pelvic physio. You're actually going to do it with others who totally get what you are going through and who are going to support you along the way. Now, this is the most exciting piece for me because one-on-one physio is, it's out of pocket. It's a lot of money, right? Let's be honest. Like it takes our clients about 6 to 12 sessions in order to help them achieve their personalized goals. This program is for the price of $250. For reference, an initial assessment at our clinic is $195. So this is literally this, you're going to get 6 sessions for less than the cost of 2 physiotherapy sessions. And it's at lunchtime EST and it starts next week. Everything will be live, but it'll also be recorded. And it's one of the most exciting things that is going on right now because I'm so excited to offer this to you, offer this opportunity to actually stop peeing in your pants. To be honest with you, if you just go home right now or stay home wherever you are, and you just do your breathing and you start to connect with that pelvic floor, connect with that relaxation, start to drink more water, you are going to be so much further ahead than you ever were. But if you're ready to stop leaking and you want that guidance once and for all, I would love for you to join us and take control of your pelvic floor. I'm going to throw that link into the chat. If you are interested and you're like, let's do this, let's go. If you have questions for me, I am so happy to hang out with you tonight and answer them. And if you want to unmute yourself or make yourself ask your question in the chat, you can absolutely do that. I'm really happy to answer any questions you have. Hi, Risha, good seeing you here. And I'm really so appreciative that each of you came to hang out with me today. I'm going to stop the share. And does that mean stop the Kegels? What I will say to you, Deb, is if you have been Kegling and it is not working, I would say start practicing that relaxation. You're probably amazing at Kegels. If you've been doing the Kegels nonstop and it's not working, it's probably not the solution for you. I would test it out. See, do some breath work, do the relaxation, do the pieces where you're actually focusing on releasing those muscles and releasing that core and see what happens. I bet you're going to get better results. Okay. Oh, scrolling through. Risha, so nice to see you. If you have anything to add, let us know. She's 9, always has to go washroom 2 times before leaving the house. She is yes. So Christine, it's actually like we sort of, I don't like, listen, all parents are doing their absolute best. But when we teach our kids to pee just in case before they go, oh, okay, we're heading out now, everybody pee. We're actually training that just in case. We're training our kids to not trust their signals from their bladder. And it's really valuable for us to say, do you feel like you have to pee? And ask our kids what they're feeling, because actually we do pediatric pelvic physio as well. And a lot of kids are incontinent because they're constipated, they're not drinking enough, they don't trust, what's it called? They don't trust their bodies same way. All right. So informative. Thank you. Lori, we don't have any times. We don't have any other times, but we will be sending out the replays. This is our first time running it. And so if you are interested in attending the next one, then I will throw in here our email address. Just let us know. We'll throw you on the wait list for the next one. This is a program we are going to be running regularly. It makes pelvic health super accessible, and I can't say it enough. It's really, really important. Does this work for men too? Deb, every human being has a pelvic floor. Yes, yes. We all need to learn how to trust our bodies, and there are a lot of men who are incontinent and they don't have to be. Deb, amazing. Dr. Sharon, we're working on it. We really, really are. It's funny. We do a lot of in-services for doctors, but the truth is, this is the area specializing for physiotherapy. This is what physiotherapists do. And so the same way that an orthopedic surgeon wouldn't know how to rehab a knee, they send you to physio. It's the same thing for pelvic floor physio. I need to jump off now. Be out of province most of the May. Natalie, listen, if you don't have to be in province in order to do it, we would love to have you. It's virtual, so works wherever you are. I'm so grateful for each of you for coming out tonight. And if you, thanks, Sarah. If any of you have any questions or you want to hang out, I'm going to stop the recording. So if you want to ask a question without it being recorded, I'm happy to.